What's up, beautiful people? Another day, another study. There's a lot of hoopla online about GLPs and muscle loss, although we don't really have clinical studies looking at muscle loss. What's happening is people are looking at previous studies showing 30–40% lean mass loss with semaglutide. If you look at the SURMOUNT-1 trial with tirzepatide, there was about a 10% reduction in lean mass, and then saying, well, people are losing muscle. But if you're using bioimpedance or a DEXA scan, lean mass can be muscle, bone, organs, fluids, water, and fat tissue. So not necessarily muscle. Well, this was a post hoc analysis of a trial of tirzepatide in patients with type 2 diabetes. And also, most of them had class 1 obesity. The average BMI was around 32 or 33. And they actually did MRIs. So MRIs and CT scans are much better at determining whether we have changes in muscle or not. And so they use MRI measurements of the thigh, and they use muscle fat infiltration, muscle volume, and a muscle Z score, which is basically standardized to not involve sex, height, weight, or BMIs as a variable on that muscle volume. So they were comparing tirzepatide to patients on insulin. And then as a baseline, they used data from the UK biobank as a reference for how these changes in muscle composition relate to weight change. So they found that when tirzepatide was compared to insulin, tirzepatide reduced muscle fat infiltration, muscle volume, and muscle volume Z score. Insulin treatment increased muscle volume. They noted significant improvements in cardiometabolic markers and visceral adipose tissue in tirzepatide group. And when they looked at this and compared to the UK biobank, there were significantly larger reductions in muscle fat infiltration in the tirzepatide group, and the reductions in muscle volume were similar to the population-based UK biobank data on people who had weight changes. So essentially what this means is that tirzepatide was associated with greater than what you would expect loss of muscle fat and about the same loss of muscle volume that you would see in patients who were maybe using diet for weight loss or other methods for weight loss. So this is really encouraging. Tirzepatide did not accelerate muscle loss. And there are some key caveats here that it's a post hoc analysis. So these results are exploratory. They did measure muscle strength. They didn't measure the effect of diet or lifestyle parameters. I would love to see a follow-up study looking at muscle strength and examining mostly strength training and protein intake and how that can affect what we're seeing in muscle volume and strength.